welcome you to the next snippet 8 of the Quizzing Society. The next pathology snippet. So, this is related to the previous topic that we discussed, which was tumor markers. So, we'll be discussing some MCQs and clinical problems related to tumor markers. This is the first question. So, as we from the previous videos, we have already seen that we should first read the last line of the any question that is given and the MCQs to first understand from which topic that the MCQ has been chosen. So in this, the last line will be which of the following tumor markers is expressed in the immunohistochemical studies of the biopsy specimen. And the options are A. Alpha fetoprotein, B. Calciretin, embryonic antigen, D. Cytokeratins. So from this, we understand that the examiner wants to test our knowledge on tumor markers. Now we take out the important points from this question, which are that the person has a history of smoking 2 pack cigarettes per day, and he also has a chest X-ray showing a mass in the left lung, and the bronchos shows the and the bronchoscopy shows destruction of the left main bronchus. From this, the likely diagnosis is a lung carcinoma, given the history of large mass and history of heavy smoking. So with the help of options, we'll now rule out what the answer can be. So firstly, there is alpha fetoprotein, so which is typically associated with germ cell tumors and hepatocellular carcinoma. So it has nothing to do with the lungs. So we'll eliminate this option. Next is calretinin. So calretinin is commonly used to identify a mesothelioma, which is often related to the pleura, not the lungs. Hence, we'll eliminate this option as. Next one is carcinoembryonic antigen. As we studied, it is mainly related to the GIT and less specific for the lungs, but is also expressed in lung adenocarcinomas. So this can be kept as an option. Next is cytokeratins. So cytokeratin is a broad spectrum marker for epithelial cells and is positive in majority of carcinomas, including non-small cell lung carcinomas. So this is the most appropriate option. Hence, we'll choose this option. So the answer will be D. Yes, the answer is D for the previous question. Moving over to the next MCQ 2. So before giving out the answers, I think that you all should pause the video and try to answer this question on your own. So again, reading the last line of the question. So seeing the results, the physician has ordered a set of two tumor markers. Which of the tumor markers is most likely to be positive in this patient? The options are CA19-9, C is HCG, and D option is CA15-3. So from this, I understand that the question is related to tumor markers. Now I'll find out the important points from this question. So the important points from the question are that the total bilirubin is raised and the direct bilirubin given value is raised. Even the ALP is raised. From this, I understand that the person it has something to related to obstructive jaundice, because that in the question that the person has a yellow U in his eyes and tongue, which indicates icterus. So, obstructive jaundice is commonly caused due to CA or carcinoma of head of pancreas. So now, as we had studied previously, the most common tumor marker that is raised in carcinoma of head of pancreas is CA19-9. So the trick to remember that, as I told previously, was that 9 when given represents a P. So P and 9 are for pancreatic cancer. So the answer of this question will be CA19-9, which is option B. I hope you all could also answer the question. Yes, the answer of this is B. Next, moving over to MCQ 3. So again, we read the last line of the question, which is histology abnormal melanocytes invading the dermis, which cell-free DNA marker is most likely positive in this patient. Now, the important points from this question are that it is a female who has a who had a black patch which got darker and itchy. So it is the most likely diagnosis for this will be a melanoma. Now we have to figure out which of the following cell-free DNA marker will be raised in a melanoma. So the rule out the options. So the first option is KRAS mutation. So it is most commonly associated with colorectal cancer, pancreatic cancer, and lung adenocarcinoma, but not typically of melanomas. The next option is BRAF V600E mutation. So this mutation is found in most commonly in melanomas and is a key driver mutation in the development of that disease. Hence, it is most relevant for the targeted therapies. So this option right option, but we should read all the options. So the next option is SPINK3 mutation. So this mutation is not commonly associated with melanomas, but most commonly associated with pancreatic diseases. So we'll rule out this option as well. Next is EGFR mutation. So EGFR mutation is most commonly seen in non-small cell lung carcinomas and particularly adenocarcinomas, but it is not typical of a melanoma. So we'll rule out this option as well. So hence the most appropriate option for this question will be B600E mutation. I hope this video will help you and I hope you have come to the answer which is B. And if you have any queries or any doubts, you can, and any reviews also, you can message us on BVDOMC Quizzing Society Gmail @gmail.com, or you can also post it in the comments below. And please share this video to your friends as it will be helpful to them as well. Thank you.